Dogs, our loyal companions, are unfortunately susceptible to a wide range of diseases that can impact their health, vitality, and overall quality of life. As a seasoned veterinarian, I've seen firsthand how diverse these illnesses can be, from viral infections to bacterial diseases and parasitic infestations, each posing unique risks and challenges. Among the most notorious viral threats is canine parvovirus, an aggressive, highly contagious disease that attacks a dog's gastrointestinal system. Puppies, in particular, are vulnerable, often suffering from severe vomiting, bloody diarrhea, and rapid dehydration. Without swift intervention, the survival rate plummets. Similarly, rabies, though preventable through vaccination, remains a fatal menace, not only endangering dogs but posing a public health risk to humans. Another common viral culprit is canine influenza, which mirrors human flu with symptoms like coughing, sneezing, and lethargy, spreading rapidly in environments where dogs interact closely, such as dog parks or boarding facilities. Bacterial diseases are equally troublesome, with kennel cough standing out as one of the most widespread. This respiratory infection, caused by Bordetella bronchoseptica, results in a persistent, honking cough that sounds distressing to pet owners. While mild cases often resolve on their own, more severe cases can lead to pneumonia, especially in young puppies, senior dogs, or those with compromised immune systems. Additionally, bacterial skin infections can arise from minor scratches or underlying allergies, leading to hot spots, painful, inflamed areas that dogs obsessively lick or scratch, worsening the condition. In more severe cases, untreated infections can spread, causing systemic issues that require antibiotics and supportive care. Perhaps the most insidious group of canine diseases stems from parasitic infestations. Among these, heartworm disease remains a silent killer, transmitted through mosquito bites. The heartworms mature inside the dog's heart and lungs, progressively causing heart failure, lung disease, and, if untreated, death. Many pet owners remain unaware of this danger until symptoms like coughing, fatigue, and weight loss become undeniable, often when the disease is already advanced. External parasites like ticks and fleas are more visible but no less harmful. Fleas trigger relentless itching, skin infections, and even flea allergy dermatitis, while ticks can transmit Lyme disease or ehrlichiosis, leading to joint pain, fever, and lethargy. Internally, dogs may harbor intestinal worms like roundworms, hookworms, and tapeworms, which rob them of essential nutrients, causing weight loss, a dull coat, and bloating, especially in puppies. Understanding this vast spectrum of potential illnesses is crucial for every dog owner. Prevention, early detection, and timely treatment make the difference between a quick recovery and a life-threatening crisis. Regular vet visits, vaccinations, parasite prevention, and a balanced diet are pillars of proactive pet care that ensure our beloved four-legged friends live long, happy, and healthy lives. When you recognize that a simple cough, a change in appetite, or an unusual scratch could signal an underlying issue, you empower yourself to act early, potentially saving your dog's life. After all, dogs rely on us for more than just love and companionship, they count on us to safeguard their well-being. Viral diseases in dogs represent some of the most severe and challenging illnesses to diagnose, manage, and prevent. Among these, canine parvovirus, rabies, and canine influenza stand out as particularly significant due to their transmission methods, clinical presentations, and impacts on canine populations. Each of these diseases showcases unique pathological mechanisms, and understanding them from a veterinary perspective is essential for effective prevention and treatment. Canine parvovirus (CPV) is an aggressive and highly contagious virus that primarily affects puppies and unvaccinated dogs. It targets rapidly dividing cells, most notably in the gastrointestinal tract, leading to severe gastroenteritis. The virus first invades lymphoid tissues, such as the tonsils, and spreads through the bloodstream, attacking the intestinal crypts. This results in a breakdown of the gut lining, causing profuse vomiting, bloody diarrhea, severe dehydration, and electrolyte imbalances. Affected dogs often present with lethargy, loss of appetite, and fever. The destruction of the intestinal barrier also allows bacteria to translocate into the bloodstream, leading to sepsis. Veterinary intervention involves aggressive fluid therapy, antiemetics, antibiotics to combat secondary infections, and supportive care. Despite treatment, the mortality rate remains high, particularly in immunocompromised or very young dogs. Real-world cases, such as outbreaks in shelters or breeding facilities, demonstrate the virus's rapid spread through fecal-oral transmission and environmental contamination. The virus can persist on surfaces for months, making decontamination crucial. Disinfectants containing sodium hypochlorite bleach are among the few effective solutions for killing the virus. Vaccination remains the most effective preventive measure, with initial doses recommended as early as 6 weeks of age, followed by booster shots. Rabies, caused by the Lissa virus, is a zoonotic, invariably fatal disease affecting the central nervous system of mammals, including dogs and humans. The virus is typically transmitted through the bite of an infected animal, with saliva introducing the virus directly into muscle tissue. From there, it travels along peripheral nerves to the spinal cord and brain. The incubation period can range from weeks to months, depending on factors such as bite location and viral load. Clinical signs evolve in phases. The prodromal stage may present with behavioral changes, followed by the furious phase characterized by hyperactivity, aggression, and hallucinations. The paralytic stage leads to muscle weakness, paralysis, and ultimately respiratory failure. The neurological deterioration is irreversible once symptoms appear. Rabies remains a significant public health concern, especially in regions with low vaccination rates. Case studies from rural areas often highlight tragic instances where unvaccinated pets become infected through wildlife encounters with raccoons, bats, or foxes. Post-exposure prophylaxis is available for humans, but once clinical signs manifest in dogs, euthanasia is the only humane option to prevent suffering and further spread. Rabies vaccination is mandated by law in many countries, contributing to its near eradication in some regions. Canine influenza virus (CIV), specifically strains H3N8 and H3N2, represents a relatively recent emergence in the canine viral disease landscape. Originating from equine influenza, H3N8 was first identified in racing greyhounds in the early 2000s, while H3N2 emerged from avian influenza in Asia. CIV is highly contagious, spreading through respiratory secretions, contaminated surfaces, and even clothing or human hands. Infected dogs exhibit a range of respiratory symptoms, including persistent coughing, sneezing, nasal discharge, and fever. Some cases progress to pneumonia, particularly in puppies, senior dogs, or those with underlying health issues. The virus replicates in the respiratory epithelium, causing inflammation and compromising the dog's ability to clear secondary bacterial infections. Affected dogs often appear lethargic, and their appetite diminishes. The similarity of symptoms to other respiratory diseases, like kennel cough, complicates diagnosis. PCR tests, serology, or virus isolation from nasal swabs aid in confirming infection. Treatment focuses on supportive care, ensuring hydration, and managing secondary infections with antibiotics when necessary. In severe cases, oxygen therapy may be required. Outbreaks in shelters and boarding facilities demonstrate how quickly CIV can spread in close contact environments. Vaccination, although not universally required, is recommended for dogs frequently exposed to social settings, reducing the severity and duration of illness. The interplay between these viruses and a dog's immune system further illustrates the complexity of canine viral diseases. Parvovirus-induced leukopenia, rabies-induced neural inflammation, and influenza-induced respiratory compromise highlight how these viruses exploit specific physiological vulnerabilities. Immune responses, ranging from antibody production to cell-mediated immunity, play a critical role in disease resolution and vaccine efficacy. Understanding the unique molecular biology of each virus, from the single-stranded DNA structure of parvovirus to the negative sense RNA genome of rabies and influenza, enables veterinarians to better predict disease progression and design targeted interventions. Environmental factors, population density, and vaccination coverage heavily influence disease prevalence. Urban areas with high dog populations and frequent social interaction create ideal conditions for respiratory viruses like SIV to thrive, while rural areas with wildlife exposure face greater rabies risks. Canine parvovirus, with its environmental resilience, remains a constant threat in both urban and rural settings. Recognizing these patterns helps veterinary professionals and public health officials implement effective control measures. Ultimately, each of these viruses represents a formidable challenge to canine health. By delving into their unique pathophysiologies, transmission routes, clinical manifestations, and prevention strategies, veterinarians gain the insight necessary to protect dogs from these devastating diseases. Continuous research, vigilant vaccination programs, and public awareness are vital in mitigating the impact of viral diseases on canine populations worldwide. Bacterial diseases in dogs present a complex and diverse array of challenges to veterinarians, particularly when dealing with respiratory infections like kennel cough, systemic conditions like pneumonia, and localized issues such as skin infections. Each of these conditions involves unique bacterial pathogens, physiological impacts, and treatment approaches that require a nuanced understanding of canine anatomy, immune response, and environmental factors. Kennel cough, known scientifically as canine infectious tracheobronchitis, is a multifactorial respiratory disease most commonly associated with the bacterium Bordetella bronchoseptica. This bacterium is an opportunistic pathogen, thriving in dogs exposed to crowded, poorly ventilated environments like shelters, kennels, or dog parks. It often acts in conjunction with viral co-infections, such as canine parainfluenza or adenovirus, creating a synergistic effect that exacerbates clinical signs. Bordetella attaches to ciliated epithelial cells lining the respiratory tract, releasing toxins that impair the cilia's movement and lead to mucus buildup. The hallmark symptom is a harsh, dry, honking cough, frequently triggered by excitement or pressure on the trachea, such as from a collar. In mild cases, dogs may remain alert with normal appetites, while severe cases can progress to lethargy, fever, and secondary pneumonia. Treatment depends on the severity of the infection. Mild cases may resolve with rest and supportive care, but more aggressive cases require antibiotics like doxycycline or amoxicillin clavulanate. Intranasal or injectable vaccines provide varying levels of protection, though immunity is not absolute due to the diversity of contributing pathogens. Pneumonia in dogs represents a more severe and life-threatening bacterial disease, typically categorized into aspiration pneumonia, secondary bacterial pneumonia, and infectious pneumonia. Common bacterial culprits include Streptococcus spp, Staphylococcus spp, Escherichia coli, and Pasteurella multocida. The pathophysiology involves the invasion of the lower respiratory tract, where bacteria bypass the upper airway's natural defenses, either due to inhalation of foreign material, aspiration pneumonia, or as a complication of primary respiratory diseases, infectious pneumonia. Bacterial colonization triggers an inflammatory response, leading to alveolar filling with pus, fluid, and immune cells, impairing gas exchange. Clinical signs include productive coughs, fever, dyspnea, difficulty breathing, nasal discharge, and lethargy. Diagnostic imaging, such as thoracic radiographs, reveals alveolar patterns indicative of consolidation. Bacterial culture and sensitivity tests guide antibiotic therapy, with broad-spectrum options like amoxicillin clavulinate, enrofloxacin, or cephalexin initiated empirically while awaiting results. Supportive care involves oxygen therapy, nebulization, and coupage to aid in mobilizing respiratory secretions. Cases of aspiration pneumonia, commonly observed in brachycephalic breeds or dogs with megaesophagus, emphasize the importance of addressing underlying causes alongside antibiotic management. Bacterial skin infections, or pyoderma, range from superficial hot spots, acute moist dermatitis, to deep infections involving the dermis and subcutaneous tissues. Staphylococcus pseudointermedius is the most frequently isolated pathogen, although opportunistic bacteria like Pseudomonas aeruginosa may complicate chronic cases. Superficial pyoderma often arises secondary to allergies, parasites, or hormonal imbalances that compromise the skin's protective barrier. Dogs present with pruritus, itchiness, erythema, redness, pustules, crusting, and alopecia, hair loss. Deep pyoderma involves painful nodules, draining tracts, and significant inflammation, frequently linked to immunosuppression or foreign bodies. Cytology using impression smears or fine needle aspirates reveals neutrophilic inflammation, intracellular bacteria, and sometimes cocci or rods. Antibiotic selection follows culture and sensitivity results, though empirical choices like cephalexin, clindamycin, or potentiated sulfonamides are common starters. Topical therapies, including chlorhexidine shampoos or antibiotic ointments, support systemic treatment. Chronic or recurrent pyoderma cases necessitate investigation into predisposing factors, such as hypothyroidism or environmental allergies, to achieve long-term resolution. The interplay between bacterial pathogens and canine immune defenses is a critical aspect of disease progression and treatment outcomes. Bordetella bronchoseptica employs virulence factors like filamentous hemagglutinin and pertactin to adhere to respiratory mucosa and evade immune detection, while Streptococcus species in pneumonia cases produce polysaccharide capsules that inhibit phagocytosis. Staphylococcus pseudointermedius, particularly in skin infections, may develop methicillin resistance (MRSP), complicating antibiotic therapy. Understanding these bacterial mechanisms guides veterinarians in choosing appropriate antimicrobials, balancing the need for effective treatment with antimicrobial stewardship to prevent resistance. Environmental factors, breed predispositions, and host immune status heavily influence disease susceptibility. Kennel cough thrives in high-density canine populations with poor air circulation, while pneumonia risks increase in dogs with anatomical abnormalities or chronic illnesses. Skin infections are more prevalent in breeds with skin folds, like bulldogs or Shar-Peis, due to increased moisture and friction. Recognizing these risk factors supports targeted preventive measures, from vaccination protocols and environmental management to regular skincare routines. Bacterial diseases in dogs, while diverse in presentation and severity, share common themes of opportunistic invasion, immune evasion, and inflammatory damage. Veterinary interventions rely on accurate diagnosis, appropriate antimicrobial use, and comprehensive supportive care to ensure the best outcomes for affected dogs. By exploring the distinct yet interconnected pathologies of kennel cough, pneumonia, and skin infections, veterinarians can refine their clinical approaches, improving both immediate treatment success and long-term disease management strategies. Parasitic diseases in dogs encompass a diverse range of infections caused by internal and external parasites, each contributing to distinct pathological changes and clinical manifestations. Among the most significant parasitic diseases are heartworm, Dirofilaria amitis, ticks, fleas, and intestinal worms. Understanding the biological behavior of these parasites, their life cycles, and their interactions with canine hosts is crucial for effective diagnosis, treatment, and prevention. Heartworm disease, caused by the nematode Dirofilaria amitis, is one of the most serious parasitic infections affecting dogs. Transmitted through the bite of an infected mosquito, heartworm larvae microfilariae enter the dog's bloodstream and migrate to the heart and pulmonary arteries, where they mature into adult worms. This maturation process takes approximately 6 months, after which the adult worms can grow up to 30 centimeters long and live for several years. The physical presence of these worms obstructs blood flow, leading to pulmonary hypertension, right-sided heart failure, and damage to the lungs and liver. Early clinical signs may include a mild cough and exercise intolerance, progressing to severe respiratory distress, ascites, fluid buildup in the abdomen, and syncope, fainting as the disease advances. Veterinary imaging, such as echocardiography, often reveals worms in the pulmonary artery, while antigen tests detect adult female heartworms. Treatment involves a complex protocol using melarsoamine dihydrochloride to kill adult worms, coupled with doxycycline to target Wolbachia bacteria symbiotically associated with the heartworms. However, the prevention of heartworm disease remains the most effective strategy. Monthly prophylactic medications containing ivermectin, milbemycin, or selamectin disrupt larval development, preventing infection before the worms reach maturity. Case studies highlight heartbreaking scenarios where untreated heartworm infestations resulted in sudden collapse due to embolism from dead worms dislodging into the lungs after treatment. Ticks, belonging to the Ixotidae family, are external parasites that latch onto dogs, feeding on blood and transmitting various pathogens, including Borrelia burgdorferi, Lyme disease, Ehrlichia spp. Ehrlichiosis, and Anaplasma spp. Anaplasmosis. Ticks undergo 4 life stages: egg, larva, nymph, and adult, requiring a blood meal at each stage to progress. The tick's saliva contains immunomodulatory compounds that prevent the host from feeling the bite, allowing undetected feeding for several days. This prolonged attachment facilitates pathogen transmission. Clinical signs vary based on the transmitted pathogen but often include fever, lethargy, joint pain, and lymphadenopathy, swollen lymph nodes. Some tick species, such as the American dog tick Dermacentor variabilis, can also cause tick paralysis through neurotoxin secretion. Effective tick control combines topical treatments, fluorolanor, fipronil, and oral preventatives, afoxolaner, serolaner, alongside environmental management like yard treatment and avoidance of tick-infested areas. Veterinary intervention in severe infestations may include manual removal of embedded ticks with specialized tick twisters to prevent mouthparts from remaining in the skin, reducing the risk of secondary infection. Fleas, particularly C. tennicephalides felis, the cat flea, which commonly infests dogs, are notorious external parasites that cause itching, dermatitis, and anemia in severe infestations. Fleas have a rapid life cycle, progressing from eggs to adults in as little as 2 weeks under optimal conditions. Adult fleas consume blood meals multiple times per day, producing copious flea dirt, digested blood visible in the dog's fur. The primary clinical manifestation is pruritus, intense itching, leading to hair loss, hot spots, and secondary bacterial infections. Flea allergy dermatitis (FAD) occurs when hypersensitive dogs react to flea saliva, resulting in severe itching and skin lesions even after the fleas are eradicated. Additionally, fleas serve as vectors for other parasites, such as Dipylidium caninum, a tapeworm transmitted when dogs ingest infected fleas during grooming. Comprehensive flea control involves treating both the dog and its environment. Isoxazoline-based oral medications lotilaner, serolaner offer rapid flea killing and extended protection, while topical treatments, imidacloprid, selamectin break the life cycle. Environmental control includes washing bedding, vacuuming carpets, and using insect growth regulators (IGRs) to prevent flea larvae from maturing. Veterinary dermatologists often highlight cases where untreated flea infestations led to chronic dermatitis and anemia severe enough to require blood transfusions. Intestinal worms, including roundworms, Toxocara canis, hookworms, Ancylostoma caninum, whipworms, Trichuris vulpes, and tapeworms, Dipylidium caninum, inhabit the gastrointestinal tract and cause a variety of clinical signs depending on the species and worm burden. Toxocara canis, a zoonotic roundworm, is particularly prevalent in puppies, transmitted transplacentally or through the dam's milk. The larvae migrate through the liver and lungs before being coughed up and swallowed, maturing in the small intestine. Infected dogs exhibit poor growth, a pot-bellied appearance, diarrhea, and vomiting. Hookworms attach to the intestinal lining, feeding on blood and causing anemia, black tarry stools, melena, and weakness. Whipworms embed in the cecum, inducing chronic diarrhea and weight loss. Tapeworms, often detected by the appearance of rice-like segments around the anus, cause fewer symptoms but signify flea infestation. Fecal flotation tests, PCR assays, and microscopic examination aid in diagnosis. Anthelmintic medications like fenbendazole, parental pomote, and praziquantel effectively eliminate these parasites. Regular deworming schedules, especially in puppies, alongside monthly preventatives, minimize reinfection risks. Case examples include shelters overwhelmed by roundworm outbreaks in litters, requiring aggressive deworming and sanitation protocols to control spread. The parasitic diseases explored, heartworms, ticks, fleas, and intestinal worms, each illustrate a distinct host-parasite interaction, varying from internal vascular damage to external irritation and systemic pathogen transmission. By dissecting the life cycle, clinical signs, diagnostic techniques, and veterinary management for each parasite, it becomes evident that prevention, early detection, and effective treatment are essential to safeguarding canine health from these pervasive and persistent threats. In the intricate world of canine health, the diversity of diseases affecting dogs underscores the importance of vigilant care, early intervention, and comprehensive prevention strategies. From the devastating impacts of viral infections like parvovirus, rabies, and canine influenza to the relentless grip of bacterial diseases such as kennel cough, pneumonia, and skin infections, each condition presents unique challenges. Parasitic threats, including heartworms, ticks, fleas, and intestinal worms, further complicate the landscape, often causing insidious damage before symptoms become evident. The interconnected nature of these diseases, where a weakened immune system from one illness may pave the way for secondary infections, highlights the need for a holistic approach to canine health. Vaccination protocols stand as the first line of defense against viral pathogens, offering a shield that not only protects individual dogs but also contributes to herd immunity within communities. Meanwhile, bacterial infections require swift identification and targeted antibiotic treatments to prevent complications and antibiotic resistance, an increasingly pressing concern in veterinary medicine. Parasitic infestations demand ongoing preventive measures, from monthly heartworm preventatives to regular flea and tick control, safeguarding dogs from both direct harm and the secondary diseases these parasites transmit. Beyond medical interventions, responsible pet ownership plays a pivotal role. Ensuring balanced nutrition, regular exercise, and routine veterinary checkups fosters resilience, empowering a dog's immune system to withstand potential infections. Environmental hygiene, cleaning bedding, managing outdoor spaces, and minimizing exposure to high-risk areas like crowded dog parks, further reduces the likelihood of disease transmission. The emotional toll of witnessing a beloved pet suffer from preventable illnesses is profound, emphasizing the importance of proactive care. Dogs rely on us not only for love and companionship but also for protection from these invisible yet formidable threats. Every tail wag, joyful bark, and moment of unwavering loyalty they offer is a reminder of the responsibility we bear to ensure their health and happiness. By staying informed, vigilant, and compassionate, we equip ourselves to navigate the complexities of canine diseases, fostering longer, healthier, and more vibrant lives for our four-legged companions. The journey to safeguarding a dog's well-being is ongoing, but with knowledge, dedication, and preventative care, we can turn the tide against these diverse diseases, ensuring our loyal friends continue to thrive by our sides, as they were always meant to.